One of the main concerns that parents face is nasal congestion or noisy breathing. So I mentioned nasal congestion because that's the most common cause of noisy breathing in a baby, but noisy breathing can also be due to other factors. So nasal congestion happens in many babies, especially in the first few weeks, as the nose is a small passage, and we can use saline drops. We can consider positioning the baby appropriately. Reflux is the other cause of noisy breathing, where the baby brings up the milk and the acid in the milk irritate the back of the airway, which gets inflamed, and this leads to a rasping noise as a baby breathes. Reflux is separately discussed in a playlist I refer you to. The third not so common factor is something called laryngomalacia, which is congenital anomaly of the airway. The upper airway has cartilage supporting tissue, and sometimes this is thin and not as strong. So babies may have a noisy breathing, especially as they take a deep breath. This becomes aggravated when the baby is crying or makes an increased effort. Laryngomalacia tends to resolve with age, but in some cases they need support, like support with feeding and so on.